near den near Ahode Wom. Baby Biara one or Honchia and a Medima Sabri. Ejumedia ya to the dinner time with Tatapsen Sabri so and I would say. Na ene ye betwetwe nkobo edi nkoma na ye kama the topic ni ye early detections say ye bepe ehu bibi in term and I say ye bema ye ni ada ye ho so and also the benefits of regular checkups in pepino nkofo en person beko hospital obi ka rotibika cho say me nkonko pe ehu ne wom na eno no ka bema ye mhyehyɛ ama yare no achemi ato honom anase aka no ada honom the saint no ye ni ye nwa bema Dr. Stephen ADU-YEBOAH and eba betwetwe nkomo na bibia akoso kama nanse ne behye dwumede nas no ye befa akonye so ni akokogye aboafo nkrato aba because ye penyefo se okoto se krama esia papa so a na nya ne penemom no obi ene kukuru no de nesi o ne saint no feel good services adarema omusi open motivational speaker na say any mental health educator home na fe domo no transe any nkomoma no kama mental health is real. The saint no finding treatment and therapy for it is also equally real. Feel good homes say bra normal baby papa emfa wuti ento sama ya beye ebusuanfo ne adofo ehyiahia ewo bia ne baby bebre titiro Ghana also our apartment kama ewo Pokwase East Legon Hills and Ajingano our studio 1 bedroom and a 2 bedroom apartment fully furnished now here no Ontario any webusuanfo de kwaje wa home na so etimi efa akonye so netimi sa wo pa asase ato anase bia wo pe dan krapo ato a o si adan kama East Legon Hills onom enche bia no ye de ho akade ebebro na opa for number yi defide so no +1513 372 5758 and answer from our Ghana number the +233 208 149 504 and our email address na ebetimi ene omo edi nkita ho Oswald Wellness LLC SMN control say so far as you live in Ohio and as a Maryland no open family nurse practitioner obetimi aboa ayo primary care manager na wetimi aboa in terms of weight management so omudimu akotene pa sa so na omo the one of the best IV hydration ebetimi emo gira wona so nya ampobode na bibia akoso kama from number no 513 268 2740 Yenyaba Millicent also say fighting financial ignorance in America paramount for her in the sense in terms of income protection, college fund plan, and I said the formula for building wealth and financial freedom. Also, the bit me aboa am wait me avoid the go farming in the world war. Also, the bit me aboa mo set up a second business a be more flexible work from home. We also was set me aboa mo wait me create the generational wealth for onu busian. Then they try to cramp with dima continue cramp on so bit me set up with one of the best life insurance policies a bit me aboa onu busian for no adofo nyina and still benefit from it whilst you are alive. Frame Yaban 937-321-2270 and that's at 937-270-9882. Tatapsen na Daramanti na mino mienu yeti had him say and ye did you dear brown penny forces or to say kuti ejina quantanaya na nya na kukudra na ni mriketuntia na Selbeto say HITV yejina kwantana na eya kukudo kakraka Tatapsen e dia boye chidoma ye di dwumede e bra ni sente no download the app no or Apple Store na Google Play Store for promo code no PKHMP-KAY na make sure say Tatapsen dey easy, fast, secure and very convenient. Rate no so dey edimu akotene pa na adi promo code ni shema or first transaction abese ni ska ko fee akoma busuafo na adofo no obinya $15 na we so now send me screenshot na dane abre nyina send ya canon no o de bramia memma emo bottle back not just me emo bottle back now so oni we busua e de twam spedede sabre ye beda aboafo nyina ase se o maso ya se no monkoso na mo support djumedi a yedi no na yeso ye de neye ene ne mapa ene bebram e mabobo ano sabre yeyu eno efi ho quick no producer be my quick commercial bia e kyerɛw mia ene ahodo mia hodo a Tatapsen edua sabre yeseni sekefi ye buy na akoti update from Tatapsen akachi. Then right after that the show will be transitioned into English with your guest for today because your guest no brofone no ofele more convenient and I say bia opeso ka Italy kasa hand and Dr. Daniel say oti Italy pa ne yenwa be Stefano Dr. Stefano ADU-YEBOAH be kire ne se oti we ya oti Italian na ono no ne Italian ankasa no entido producer fire try ho kakra ni embra You are for countries a betwa so no na ho baby aye wudu sisi director yema akwa baba dwumede izo
Yeah, became me Joso. Sorry.
one point to say
Nyami adom na we.
nyame adom sabre esra ede na ekoso startup sen akache maye ho ote nkana
Um
mede ma no za makotro match ama Dr.
ah
Steven so Italian pa kese pa
kakra bi na ka Dr. Steven ke ye tani bibia into Italian na nko mbu hu say yes.
the would ya want it or no the minimum sort it one
Oh,
am nisa
said
want it
me buga na market one na kam ne ne be.
uka broken Italian
Se me ne ka sanasa. Se won tefi.
nasa
Se ni
mate
agi show na fa.
proceed
Emre bi a ngrofo no be take show ni fa no enu bi.
the proceed
Anyway, Abusha for your church amunyina. We do Monday. I mean, you remember you are on the biggest platform so far in US, HRE TV, time with Tap Tap Send. Inti, the best church I'm so akwaba. PK right now, I mean, Q3, what we are doing is
and then
I
nipa
think
be bread no we kill three to bit me
okay.
breaking down say be a
So
third quarter
okay, you're the third quarter of the year, right? Inti. What we are doing is I think ambassadors in India, you've had the first hand of the wallet, so we are going to open up for everybody to have it. Now I need you to say woman say I need you to say woman say PK, do you hear me?
oh yeah talk apa
Okay, good. I need you to say woman say yeah, per se, yeah, the virtual card back app on so where you can use it to buy stuff outside into a better wallet. I think most of you who have experienced those apps, you have a wallet, you have a virtual card where you put your money on and then you can use it for spending and stuff. And before you have that card, you need that wallet, Until we advise Ubia activate wallet. And before you do the wallet, you need to authorize, do your KYC. KYC ni uploading of ID in your money. I must say be able to maintain access to your wallet, so you can also have the card. The TOSUBIM, which is very important. I think young crow for you because we for no they be how much change style.
mina
And
for the mudia mo do so mudia
now for them do mama just own piece kebi own page you maybe but own page crop physical. They always turn the star. So this time, what they are doing is, I think they're putting some fake numbers out there. And it is a mistake now. Saka, unim say you are contacting customer service tap send, but unfortunately, you end up with a different person, and they might take in charge of your app or access to your cards, your bank credentials and stuff, and start using it. First of all, tap customer service be any no more or demanded for cards and some information because we already know it. I mean, we can see it. So obi be or contacting and also be friend or demand full o card ne or CCV or CVV ne sa ne mano. You be careful what you're doing. Verify the numbers you also call before you do it. Until you go inside the app, you go to help support and you select any of the option. Now, like I say, you need more help. You see all the contacts where you can contact. Timi sɛ moma yɛ nyinaa yɛnna yɛn ho so. Na sɛbi obi wankɔwie wɔ obi nsɛm. Ebi a time a yɛbɛtry sɛ yɛ rescue no na ebi a biribi ɛfiri so. Nti yɛbɛsrɛ mo. For it to not affect a lot of people, until we are also working on it. Said the live chat beba app on so you only click on the live chat and you talk to the CS. I think that is the next thing we are doing now. Into enche no so be live CA. Into na just PK the let me also put this across. Last month we were doing this promo. Refer 10 people and then you get 150. CCA no, you who say 10, maybe a bit of a stretch, so yeah, about 5. And there we have moon pushy. And secondly, you couldn't be Brabeki Kawana, Pikable boy. So if you go in the payout countries now, you see all the countries are become international say Ubetimi are referring from everywhere to get that NIPA 5 or more, no, to get that bonuses or promo na no. Nti na just PK kakra e wo ho no se bibi wo ho na question bi so wo ho no ma we can clarify me that's it.
Yeah, that's it. Yeah, that's it. Friend is saying, meaning say, obe welcome Dr. Stephen. Na fe dia ye di djumede na hyehyɛ so dia ni nyina ye pe wo Italy mu.
Okay, buonasera Dr. Steven. Allora, diamo benvenuto.
Akwande kanya dia no. We Google that. Okay. Producer. Director Google that. Okay.
Allora, lascia sta PK. Facciamo oggi. Lo facciamo noi, ok? Perché lui non dorme bene, ovviamente è sparacazzata.
Non capisce niente lui.
Ecco. Non capisce niente.
Io alopecia na okay dey enti yo nota alopecia na okay
na. Okay.
No, cause nota alopecia.
I can't alopecia million.
What has my producer kai? Lord they say, "Oh, be cow there no difference home, but could reading about could near natural." Wow.
Va bene.
Where the to
capisce.
Yeah.
Right. Okay. Ebusia for best station no pronto sabre ya da mu nyina access baba Mr. Afin wa join and wa share link na ama Ebusia for Zoom link down because questions are really going to be welcome. Yeah, the director say show be nkwa bit wa force director man can Italian the word trim nyina na ye hu say please share the link to your families and friends. Please share the links to your loved ones, even your haters. Share it to them because sometimes we always say, I don't wish this upon my worst enemy. So even if you have an enemy, share this link to them. And we are open for questions and answers after Dr. Stephen's presentation. So please go ahead and share the links so that everybody can be a part of this August event and that's an August show. Thank you guys very much for coming. And again, I welcome you all to the show. And I'd like to introduce our guest for tonight. He's no other person but Dr. Stephen ADU-YEBOAH. He has been on this show before to talk to us about sleep apnea, how a lot of people have sleep apnea and they don't even know said they have it. And that was about almost 2 years ago. And today he's here to talk to us about early detection, the benefits of having regular checkups. Dr. Stephen, welcome back to the show.
Thank you, OPK. Thank you very much for having me one more time.
Exactly. And I know it was a short notice because, again, it was demand of the pool that we created and our viewers on the platform, demanded to have this topic treated. And thank you very much for taking time out of your busy schedule. Even with your event this weekend, you were still able to make time to put something together to come talk to us. So with that being said, we're going to hand over the platform to you and just educate us on this beautiful topic. Then after that, we're going to have some room for questions. Then we're going to open up the phone lines for people to also call in and ask questions, as well as reading questions from Facebook and YouTube. We are live on Facebook, Checkups in Ghana, Facebook HRE TV, and as well as YouTube HRE TV, and also right here at Zoom. And please, if you don't have the Zoom link, or if you have the Zoom link, send the Zoom link to your friends and loved ones so that they can all be a part of it and have first-hand information. Dr. Stephen, please walk us through the process.
All right. Thank you, my friend. For those who don't know, PK and I go way back. Now, all these years, I would see the fact that you speak Italian, I don't mean speak it. It's Daniel, how cry. But again, thank you for having me. As PK said, I'm a physician. My primary training is actually in primary care, but I also specialize in sleep medicine. And as of right now, my practice is in full-time sleep medicine. That's what I do. But I also have to maintain my primary care certification. And so this opportunity was also good for me to also review some of the things that I might not have addressed or reviewed recently. as PK said initially, I'm not as comfortable with the tree. I am comfortable with tree colloquially, not in a formal setting. And I'll mix it up. Is it safe to mix it up? Everybody
I
speaks
think
tree
it
on
would be
this
better
line,
to
or
just keep it on
just speak
English,
English?
yes,
Okay,
because we
okay,
have some
all right.
viewers who do not. So I try to do the commercials in Chi. Then when it gets to the main substantive topic, we treat that in English.
Sounds
So
good.
you
Sounds
you're
good.
in your alley.
Okay, all right, good. All right. So without further ado, I will share my screen, and then we'll jump into the topic of health screening. All right, can you all see?
Yes, sir.
Okay, excellent. And you can hear me well too, right?
Perfectly.
Okay, excellent. All right, so when we talk about benefits of health checkups, this presentation is not going to be a long one. As PK knows, I don't like speaking for too long because attention span gets worse by the by the generation. And so speaking too much won't get anywhere. Hopefully, I can just hit the important points. But the other reason why I wouldn't spend too much on this is because we actually hear about this all the time. I'm sure most of the people on this line have heard about the benefits of having regular health checkups or health maintenance or physicals. It's just that, especially as African people or as Black folks, based on my experience, at least what I've seen so far, that sometimes we're stubborn about it. And so we're gonna just trying to hit the important points, and then we'll go from there. Before I start, my disclaimer, as I always do before I make presentations, is that everything I'm presenting here is mostly evidence-based medicine. This means that I'm not, I didn't just wake up one day, make up this information. It's stuff that is information that comes from evidence-based science, and so you can trust it that it's not somebody's opinion per se. I am not representing my employer, who is Bon Secure Mercy Health, which means that if besides the evidence-based medicine, if I mention opinions, if I say anything that is outside of the evidence-based medicine, if it's opinion-based, then I'm not representing, it's my own personal opinion. I'm not representing my employer. Thirdly, I am providing general medical advice. For specifics regarding your own condition, you should consult your own medical provider. And so obviously there will be chances for questions and answers. I'll do my best, but always make sure that you do consult your own provider. Lastly, I have no conflict of interest to disclose. Okay, so jumping in, I want to just go, we're going to read two cases. And the topic again, for those who have just joined, is the benefits of regular health checkups. Okay, so this case is a male case. So we have a 52-year-old man who comes. It says to your office. So put yourself in a doctor's shoes. So you are the doctor today, okay? So you are, let's say, a general practitioner, a GP, or a PCP, primary care provider, and you have a 52-year-old man coming to your office for a routine physical examination. He's a new patient to your practice. He has no significant medical history. He takes no medications regularly. His father died at the age of 74 by a heart attack. His mother is alive at the age of 80. She has hypertension. He has two younger siblings with no known chronic medical conditions. He does not smoke cigarettes, drink alcohol, or use any recreational drugs, and does not exercise. On examination, his blood pressure is 127 over 82. His pulse is 80 beats. Respiratory rate, that's not important. His height is 67 inches, which is, he's a tall man, essentially, or actually 5'7", so average height. Um, and his weight is 190 pounds. And if you examine him, he has no, you didn't find, let's say you did a physical examination, you found no abnormal findings. There were no abnormal findings on physical exam. So the question is, what screening tests will likely be done during this patient's regular checkup or preventative visit? And so that's the question. So before we get to try to answer these questions, and I would like this presentation to be interactive. So hopefully, even if you don't unmute yourself, you're going to be using the chat box so that we can have this interaction, at least for portions of this presentation. So when we talk about screening test, what is a screening test? So let's clarify this. A screening test is an assessment device or test that should be cost effective, so it shouldn't be expensive. It should be a relatively cheap test with high sensitivity. High sensitivity means that if you have let's say if you test 100 people and let's say 50 of them have whatever you're testing for. Let's say you're testing for high blood pressure, and let's say that 50 of the 100 people you're doing a high blood pressure test, 50 of them have high blood pressure. Then high sensitivity means that all these people who have high blood pressure should not be lost, should not be missed with this screening test. Okay, so again, it's a cost-effective device with high sensitivity. It can be used on a large population to identify people with diseases. So when we speak about screening tests, that's what we're referring to. Okay, hopefully it makes sense. Next thing is, by the way, if you have any questions, something doesn't make sense, you can drop it in the chat. PK, don't hesitate to interrupt me if you see something or I say something that is not clear, or somebody drops something that I missed from the chat. You can always interrupt.
Okay.
So when we talk about health maintenance is what colloquially we say as checkups, regular checkups. Okay, so this is a preventive care for patients prior to development of disease. And so this is meant to be a checkup before the disease is developed. So when we talk about health maintenance, that's what we are referring to. Okay, let's go to the second case, and then we'll get to the interactive portion with the questions. So the second case is, now we have a 50-year-old Caucasian woman new to your practice. Again, put yourself in the shoes of a doctor, and you are the one seeing this patient. She presents for an annual physical exam, annual checkup. She reports that she is very healthy, generally feels well, has no specific complaints. She has a history of having had a partial hysterectomy, by which she means that her uterus and cervix were removed, but her ovaries were left in place. The surgery was performed because of fibroids. She has had a pap smear every year since the age of 18, all of which have been normal. She has had annual mammograms since the age of 40, all of which have been normal. She has no other significant medical or surgical history. She takes a multivitamin pill daily, but no other medications. Her family history is significant for breast cancer that was diagnosed in her maternal grandmother at the age of 72. The patient is married, monogamous, and does not smoke cigarette or drink alcohol. She tries to avoid dairy products because of lactose intolerance. She walks 3 miles 4 times a week for exercise. Her physical examination, so let's say if you do an exam, her physical exam was completely normal. Okay, so this is the second case. The first case was the 50-year-old male. If you can see parallels between these two cases, between the male and this case, what you see as a common thread is that they were both relatively healthy. They both don't have any complaints. They both don't take any medication. They both don't smoke. They both don't drink alcohol. They both don't do recreational drugs. And they both don't have any complaints. The only difference is that this patient here has had a history of hysterectomy, but it doesn't seem like surgery came with any complications. And so they're both relatively healthy. So when we talk about health maintenance, this is what we're referring to. Okay. So now let's get to the question. This is the part that I need you guys to be interactive. So when we talk about screening tests, so what screening tests for cardiovascular disease will likely be recommended for this patient? So if you are the doctor, what kind of tests for cardiovascular disease, when we say cardiovascular disease, we're referring to heart disease, will likely be recommended for this patient? This is one question I want us to discuss, and then the answers will come, but I want us to discuss this first. And you can drop your answers in the chat as well. Anybody?
I just unmuted everyone, so if you want to unmute yourself and answer the question, please do so. So, Dr. A. iPhone said lipid profile.
Lipid profile. Thank you. So lipid profile.
I think the doctor doesn't count.
Yeah, if you're a physician, please. If you're a doctor in a different field, that's fine. If you're a physician, try to even profile. Well, you see it, it tells me that you're a physician or you're in healthcare.
Because I've never even heard it before.
Exactly, it's a terminology that you only hear in healthcare. So, but thank you. Lipid profile is one of them. We'll talk about it. Anything else that you think these individuals, whether the male or the female, should get done as a screening test? And this is for cardiovascular disease, meaning for heart disease. Stress test. Okay, so somebody said stress test. A stress test, for those who don't know, is a test that typically we do for people with suspicion of something going on in the heart, especially coronary artery disease. And so you put the heart under stress either through medication or through exercise, and then you're doing either an echocardiogram or an ECG to see if it's showing that there's a blockage in your heart arteries. So somebody said stress test, somebody said EKG. Okay. Thank you for being interactive. These are all good questions. I'll give it 10 more seconds and then we'll get to the next question.
And again, like I said, I unmuted everyone. So if you want to speak, you can unmute yourself and just ask the question. Come up with your contribution. Because right after the interaction part, I'm going to go back to muting everyone. Then once we open up for questions, I'll just unmute everyone again. Because we do this so that we prevent those hackers from taking over the show.
All right, thank you. All right, so let's go to the next question. What screening tests?
The mailer said cholesterol screening.
Cholesterol screening. Okay, good. So lipid profile, cholesterol screening, same thing. That's a really good answer. Okay. The next question is, what screening tests for other chronic diseases should be recommended for this patient? And this is can apply to either the 50-year-old male, I think it was 50 or 51, I forgot the age, but middle-aged male, or the 50-year-old female. What screening tests for other chronic diseases do you think could be important? Somebody said HbA1. Listen, you are in healthcare. You're not going to write HbA1c if you're not in healthcare. So I might be wrong. If you're not, I apologize. But
blood glucose.
Okay. Blood glucose. HbA1c is another test for diabetes. Blood glucose is also a test for diabetes. We will do it only, it will be only valid for screening if it was fasting glucose. We can also do non-fasting, but it gets dicey. So yeah, so
what is CMP?
Hey, CMP is another test that we do to check kidney function and electrolytes.
And thyroid panel.
And liver function. Thyroid panel is a test that we do to check thyroid function. If you have low thyroid or high thyroid. So these are all good answers. Again, there's, how many people do we have now? 41 people.
Yes.
I would have loved if most of the people answering were not in healthcare, but it looks like the healthcare folks are the ones answering.
Okay. I am definitely not in healthcare. I've just had a bunch of these done.
Oh, got it. Who's this, Ben?
Correct.
Okay. Sorry about that. Okay, good. So yeah, so CMP, kidney function, liver function, electrolytes, and things like that. So yeah, so all these are things that we do. The doctor said colon cancer screening. Thank you. Good. So let's continue with the next question. So the next question is, what screening test for cancer should be recommended? This is a middle-aged, let's say 50-year-old male, 50-year-old female. What screening test for cancer should be recommended for these individuals? Okay, so some have said, already somebody said colon cancer, so the doctor said colon cancer already, so that applies to that. Prostate for male, mammogram, colonoscopy. Thank you. Really great points. Really great points. Anything else for cancer screening? There's a big one that hemoglobin, it saved my mom. So hemoglobin,
cervical cancer.
Yes, so cervical cancer is a big one. That's colloquially we say pap smear that females do. And then somebody said endoscopy. Endoscopy wouldn't be necessarily a screening test because we don't do endoscopy to find, unless you're referring to lower endoscopy. If you're referring to colonoscopy, then yes. But if you're referring to upper endoscopy, which is a camera coming from your upper airway, or not your upper airway, but let's say your nose going down your digestive system, that one we don't tend to do it as a screening test. Usually we do it if there's suspicion for something going on there. But lower, yes, colonoscopy. Somebody said breast, probably referring to breast cancer screening. Okay, thank you. All these answers are great. Thank you for being responsive. So lastly, what immunization should be recommended? And these questions, by the way, I probably don't even need to do too much of this presentation because you guys are covering everything that's done during regular health screenings. You're covering everything. So then now let's talk about immunizations. So for a 50-year-old male, 50-year-old female, what immunization do you think would be recommended? When I say immunization, I'm referring to vaccines. Hepatitis, great. Which hepatitis? Do you know? Celi, sorry if I'm butchering your name.
ABC.
And is that abbreviation for Selena? Hepatitis C. Yes, hepatitis C. That's something that we do. So ABC, but usually for screening purposes, hepatitis C is what we do. And I'll go over this. For those who don't know, hepatitis C is a disease, it's a viral disease of the liver, mostly affects the liver that can lead, it can be slow growing. And so it can come without symptoms, but then the liver is deteriorating and it gets to a point that you can develop cirrhosis, which then can have a risk of developing into liver cancer. So that's part of the reason why we do it. It's not as common among people who don't do IV drug use and things like that, but we still do at least once in a lifetime. Somebody says shingles. So shingles vaccine, thank you. Shingles is something that we also recommend, usually not at the age of 50, that I remember correctly, but yeah. Flu shot, okay, really good. So flu shot is something that's recommended on a yearly basis. And somebody said pneumococcal, somebody said pneumonia, same thing. So yeah, a pneumonia vaccine is recommended, usually depending on the age. If you reach a certain age, it's recommended. Obviously, babies, and children get it done as a series. But then as you become an adult, if you have some risk factors like respiratory diseases like asthma or like COPD, then you get it done. You get more of these done. And then everybody that reaches a certain age, usually in the 60s, is when they get it done again. So Tdap again. So great points. Great points. Sleep apnea test is not a screening test. It is a test when someone has sleep problems and they can't sleep well and they feel tired during the day, and there's a risk of that being connected to heart disease or increasing the risk of having heart disease in the future. And we test them for that. And obviously that's my field, and I'm sure that's why you brought it up. But we don't do it as a routine health checkup screening test. But good point, good shot. So thank you so much for being interactive. So these are all things that we do, and you've covered most of it. Okay, so when we break it down, so when we talk about cardiovascular screening, we're referring to one thing that nobody mentioned, because we get it done so routinely that you don't even think about it. But a very basic cardiovascular screening test is just blood pressure, checking blood pressure. And we screen for high blood pressure.
Oh yeah.
Or hypertension. BMI is important. I think somebody mentioned it, or maybe not, but BMI, and what we're doing is to check to see if you have high BMI. And BMI, for those who don't know, means body mass index, is a ratio of weight over height. And if the number is let's say between 20, and I'm simplifying it to make it simple, between 20 and 25 is considered normal, 25 to 30 is you're overweight, 30 and above, you're obese, okay? And then there are different degrees of obesity, all the way to morbid obese and things like that. And so the reason why this is done, it should be done at least, is that higher BMI are associated with metabolic diseases like high blood pressure, high cholesterol, and diabetes, and then these then can lead to heart disease and stuff like that. So that's the reason why. And somebody mentioned earlier lipid profile, cholesterol test. That's PK, if you remember, that's what I said. Yeah, that's all
Right.
for. And the reason is that having high cholesterol is actually a risk factor for heart disease. And so that's the reason why at every checkup, we recommend checking also cholesterol levels. And so so these are the basic cardiovascular screening tests that we do if you go on a regular checkup, okay? Now, recommended screening for other chronic conditions, and you guys covered most of these. Fasting glucose or hemoglobin A1C, these are screening for diabetes. So they'll always check your diabetes as an adult to make sure, check your diabetes, test for diabetes to make sure you don't have diabetes. And if you did have it, then something is being done. Some people might not have diabetes, they might have pre-diabetes, which is the stage just before diabetes, that if something is not done from a lifestyle standpoint, it can develop into diabetes. And hemoglobin A1C can help differentiate that. And hepatitis C, which you guys mentioned already, this is usually one time between the ages of 18 to 79 for people who don't have any signs of liver disease, okay? PHQ2, PHQ9, these are screening tests that are done to screen for depression. And this is something that is very important. And so who best to test this than your doctor that you see on a yearly basis to make sure that even if if you didn't have depression last year, something might have happened or you might have developed it. And so every year that should be screened. In big hospitals nowadays, they don't even do the PHQ9, they do the PHQ2 as a screening. And if the PHQ2, which is just 2 questions to see if you have depression, or to see if there's any suggestion that you might have depression. If that is positive, then they ask more questions for depression screening, and then you may or may not be diagnosed with depression. And then we also, at least it should be done, is screening for illicit drug use. Obviously, if there is already a relationship between you and your doctor, they're not going to ask you every year if you do if you do drugs, right? They know you already; they've known you for years. But for new patients that you don't know, it's always good to ask that question. We don't do routine testing for it per se, like doing like a urine drug screen, but we at least ask questions. And if there's suspicion, or there's a possibility, then that urine drug screening might be done. Okay. Okay, good. So hopefully this makes sense. This is recommended screening test for chronic conditions, and then recommended screening test for cancer. So fecal occult is just something that I think in most places nowadays in the West. By the way, everything I'm talking about for people who have joined from outside of the United States is mostly pertaining to the United States. I know the principles we can apply wherever you are, but these are things done within the US healthcare system. But fecal occult is just a test that is done just to check your stool to see if there are any traces of blood. This can be different kinds of fecal occult. There is regular fit test. There is like a fit, different kinds of fit tests. And then there's also Cologuard. There's also a kind of fecal occult. Cologuard not only looks for blood in the stool, but it looks for like abnormal DNA. And so Cologuard has now become very common because some people, for some reason, don't want to do colonoscopy. And so if they can do something else other than colonoscopy, Cologuard and fecal occult are acceptable alternatives, even though because they are not as comprehensive as a colonoscopy, they need to be done more frequently. Some of the fecal occult needs to be done on a yearly basis. Cologuard is every 3 years, I believe. Colonoscopy, depending on the results, if you do a colonoscopy that's completely normal, is every 10 years. And so, you know, there's pros and cons with either of them, but these are all for colon cancer screening. For males, somebody mentioned it in the chat, prostate cancer screening. There's a question mark there. You know why there's a question mark? And that is because, and healthcare providers, I know among us will know, is that there's been some debate in recent, especially in the past decade, about the utility of routine screening for prostate cancer because of sometimes the question of, do the benefits of screening outweigh the risks? Sometimes screening might suggest you might have, prostate cancer. You might have it, but prostate cancer can be different grades. If you have low grade, they have like some scoring system called Gleason score. I'm not going to get too much into it, but if it's low grade, it might progress very slowly and you could live till 90 without suffering too much from this form of cancer. Whereas sometimes, thank you, somebody clarified that Cologuard, yes, it is every 3 years. Yes. Sometimes, when you go through the treatment for prostate cancer, especially if it's a low-grade cancer, the side effects from the treatment, whether it's radiation, whether it's surgery, the side effects sometimes are not good. And we're talking about now you are incontinent. It's hard to hold your urine when you have to go. We're talking about blood in the urine sometimes, sexual dysfunction. So I'm not recommending against screening. All I'm saying is this has been debatable recently. There's been a debate. And so when you ask the urology body of the United States, I forgot that the American Urology Association might be, but they recommend doing it. But then the age is also debated. Some say should be done not earlier than 50, some say 55, and so forth. But prostate cancer is something that we do bring up. We used to do, for those of you who are a little bit older, you might have gone through it. We used to routinely do digital rectal exam. That is no longer routinely done by primary care providers. If you go see a urologist because you have symptoms, they will do it. And this is a test to figure out if your prostate is enlarged. And if it's enlarged, could it be that is it smooth or is it rough? If it's rough, it might be more of a risk for cancer. And so, but that's that with the prostate. Now, the interesting thing is that they have now new tests coming up, some even using AI that might be more specific and actually might become mainstream screening. And I'm not sure where they are in the progression, but I think the findings so far are promising. So PSA might not be the test in the long term. In the future, they might find something else, or they probably have found it. It's still not yet used yet, but they might find something else that will be the standard prostate cancer screening for all males. Females, pap smear, we talked about it, cervical cancer screening, ages 21 through 64. Between 21 and 30, it can be every 3 years. After 30, usually it's recommended to be done every 5 years. You're not just doing the pap, you're also doing the HPV test. And this is to screen for cervical cancer screening. And this sounds like it's very routine. Everybody does it. They don't find anything, but you'll be surprised. The rate of cervical cancer in the United States has dropped by more than 50% since the screening has been introduced. And so that is something that has been very good, as everything else that I'm speaking about. And then we talked about mammograms. Some of you mentioned it, breast cancer screening, and this should be done from the age of 40 to 74. every other year, even though I know some doctors do it every year, but it should be done every other year. If the findings are negative, if it's normal, then every other year. So everything I'm outlining here are general guidelines. General guidelines. But there are exceptions, obviously, to every case. As somebody said, STI test yearly or every 6 months, depending on sexual activities for males and females. So yeah, this depends on the age and this is individualized depending on the age. Usually, this is more recommended for younger folks, teenagers who are sexually active, or people who have track record of multiple sexual partners or sexual promiscuity. We do those tests for them, and you're right, that can be something that, as I was saying, depending on the individual case, it can be done, but we don't routinely do it for everyone. Good point. Good point. I like this group. You're very interactive.
Oh,
Lastly,
not just that, they're very smart too.
they're very smart. Yes, we're dealing with. I have to be careful what I'm saying. I'll be called out. I'll be called out. But lastly, when we talk about immunizations, and you covered it, you guys hit it. You were right.
Hold on. So before you get to that point,
Mhm.
I feel the machine pakrono. Somebody mentioned of the TDAP.
Uh-huh.
So it was actually one of the immunizations tests that somebody did mention, but I think you didn't touch on that. I don't know if you did that on purpose because you were going to talk about it now.
Yeah, I saw it. You're right. I didn't say anything. I should have said something, but TDAP was right. So TDAP is a tetanus shot that we give every 10 years.
Can you name your no Ghana Nentias? A tetanus shot.
Tetanus shot. Sorry. And it's done every 10 years, with some exceptions. For example, if you're a pregnant mother, it's also done during pregnancy. And sometimes the family is also recommended to get it done. But it's done every 10 years. Unless you've never done it, then you should do it right away. And so that's something that if your doctor checks and they find that your last tetanus, for example, was in 2012, it's been 13 years and you should get one done, they will recommend that you get it done. And then influenza vaccine is also something that we always recommend in the fall and in the spring. Now, there's been a lot of controversy about vaccines. I'm very aware, and I'm sure those of you who are in healthcare are aware of this. It was always there, but the pandemic has heightened it and made it exponentially worse. And now there's people who might have not had any issues against vaccines, who, because of so many videos, so many TikTok videos and other kind of videos, and
with those conspiracy theories.
Yes, so many conspiracies have led everybody to distrust vaccines. It started with COVID, but a lot of them, it extends to any vaccine. And now we have the secretary of the HHS, who's also secretly, I wouldn't say secretly, but I think if you look at his track record of what he said about vaccines, he changes his tone depending on the situation he's in. But generally speaking, he is not in favor of all the vaccines recommended by the CDC. And so all this is just helping to perpetuate all this mistrust. The reality is that the changes, the benefits the vaccines have brought, and I'm not here to speak about COVID vaccine. That topic could be a whole 2-hour topic. I'm speaking about vaccines in general. The benefits that have brought way outweigh the risks. And the things that have been brought up in the past, like autism being linked to vaccines, there is no evidence about that. When you look at all the studies, there is very little evidence. And the interesting thing is, then a lot of people who are against vaccines will say, "Oh, look at the Amish population." For those of you who don't know, Amish people, we have them in Ohio, they're in Pennsylvania and other places in the United States. But Amish people are people who have decided to live as if this was like the 1800s. They don't use technology. They don't use. Some of them don't use even like telephones. They don't use cars, and they want to live a simple, humble life that doesn't expose them to the temptations that modern world has brought us. And so the assumption is that Amish people don't vaccinate their children. That's actually false. They do vaccinate. Most of them at least do some vaccines, but they do have some autism among them as well. And so, all the arguments that are made are usually weak, but sometimes it depends on the person. People are charismatic, especially when you have doctors, you have healthcare providers being the spokesperson for these conspiracies. Then people who are already a little bit like in the middle will be swayed against vaccines. The reality is that there's so much evidence that the benefits outweigh the risks. The interesting thing is this, though. My argument that I sometimes, because my patients sometimes bring up these issues, and the way I usually shut them down is this, and I'm saying it in a nice way, not disrespectful, right? But even when it came to the COVID vaccine, there's so much uproar about they shouldn't have given it, it's dangerous and all that. Even though we all agree in healthcare that the messaging from the government was bad, both administrations, whether it was Trump before he lost the election, whether it was Biden, the communication wasn't good. There was a lot of things that they said that they were wrong. But the reality is that this conspiracy about vaccines were made to kill people and people are dying left and right because they took the vaccine. It's interesting how when you look at the healthcare workers population, over 90% of them, I took 3 of the COVID vaccines. Over 90% of doctors and healthcare providers had to take them. You don't hear about any diseases or any pandemic among healthcare providers. Somehow, we were not touched, but somehow everybody else is being killed by the COVID vaccine. And so anyway, I don't want to, this is a touchy subject, so I don't want to spend too much time on this, but I just want to let you know that from a doctor standpoint, from a primary care provider standpoint, when we recommend vaccines, we're not doing it because we want to kill the population. We're not doing it because we don't care. We're not doing it because we are brainwashed. We're doing it because there's a long track record of the benefits that come from it, right? And obviously, some people will have some contraindication. They might have a disease or they might have something that makes them, it's not safe for them to get the vaccine. That's fine. And not all the vaccines are as crucial as others. And so that's all I would say. I'll just stop it here. So as I'm getting to the end of my presentation, I just want to talk about the real root of why we recommend doing regular checkups. Even if you were not getting vaccines, even if you were against vaccines, regular checkups. We've talked about all these things. Cardiovascular disease prevention. We've talked about other chronic diseases like diabetes disease prevention. We talked about thyroid. We talked about things like cancer. We talked about things like communicable diseases that, unvaccinated people can transmit or pass around. And so these are all reasons why it's important. But when we look at the goal, when we push for yearly checkups, which let's be honest, us Ghanaians are not good at, the goal is that we all fall into the primary prevention category. That's the goal. So when we say primary prevention, we're saying an intervention designed to prevent a disease before it occurs. And so the goal is to be able to prevent you from having high blood pressure, prevent you from having cancer, from having heart disease, from having different diseases that are actually detrimental to the point that is causing a lot of deaths. We'll look at some graphs at the end of my presentation. And so that's the goal. The goal is prevention. So when we say primary prevention, our goal, especially if you're young, if you do see your doctor regularly, and there are exceptions, obviously, but for the most part, you will be able to fall in the category of primary prevention, meaning we will be able to make sure that we give the recommendations, that we do things to prevent the disease from coming. And so a big part of this, Pamucho, probably as a child, there's somebody tapping with the screen and
Oh no, the people came
annotating
back. The people came back.
annotating the screen. So if you could help with that. But either way, so a big part of checkup is to talk about lifestyle, and that's one thing that maybe doctors don't do a better job. They don't do a good job with it. And part of it is because our system here in the United States, it gives us very limited time. So we probably have 15 minutes. The average primary care provider has 15 minutes to talk with the patient. And out of those 15 minutes, 5 of those 15 minutes is taken by the medical assistant who is rooming the patient, right? And taking vitals. And so then you have 10 minutes. And sometimes we don't have enough time, and we should be able to spend time. So what I do for my patient, if I have something like a healthcare maintenance visit, I make it longer. I make it longer because it's important. And the important part is the prevention. So then we have to focus on the lifestyle, healthy lifestyle, balanced diet, diet that has all the important nutrients, and also regular exercise. The United States Preventive Task Force recommends that every person does at least 150 minutes of exercise, of intense exercise per week. How many of us are actually doing that? And so these are things that we should use the health checkup visit.
One minute to me. Doc,
Yes.
hold on. Ben, please check your side, because those things on the PowerPoint is coming from your side. Ben, well, please check your side. Okay, proceed.
Okay. So these are some of the things that the important that make a healthcare maintenance visit important. Okay. So examples of primary prevention are counseling for smoking cessation. If you're smoking, the purpose is to help you cut down on the smoking or quit smoking, and give you the tools to be able to quit smoking before that leads you to having a heart disease, high blood pressure, cancer, whether it's lung cancer, whether it's esophageal cancer, whether it's bladder cancer, which are associated with smoking. So the goal is to prevent that from happening. And so the healthcare maintenance is helping to address this issue. Alcohol consumption, we know, is highly associated with esophageal cancer, again, bladder cancer, some of these other organs, liver. And so the goal is to be able to help the person cut down so that they can prevent developing those problems. Weight optimization. So if you have a high BMI, to help you bring it down. And then again, immunizations against communicable diseases. So this is the goal, the primary goal for healthcare visit, like checkups, right? Unfortunately, many of us will already have developed something by the time we start doing checkups. And so then we can talk about secondary prevention. Secondary prevention is intervention intended to promote, okay, sorry, this is Herb, but it's supposed to be early. Early detection of disease or condition. And so secondary prevention is essentially finding the problem early, so that right there and then we can address it and treat it so that it doesn't progress to something big. Okay, so when we check your blood pressure, we want to make sure that you don't have it. And if you don't have it, if we're talking about primary prevention, for example, we'll talk about diet, exercise, healthy living, all these things, sleeping, and all these things, so that you don't develop high blood pressure, hopefully. But then secondary prevention is also checking your blood pressure, so that if you have high blood pressure, we can address it, we can treat it early, before it leads to heart disease, before it leads to a stroke, before it can lead to aneurysm and things like that. And so that's what secondary prevention is important. Again, the goal is primary prevention, but if you've developed something already, at least if you see a doctor regularly, we can catch it early so that we can address it. Examples: blood pressure measurement, diabetes screening, appropriate cancer screening. Hopefully I'm making sense. If you have questions, you can drop it in the chat, or just save it for at the end. Tertiary prevention, unfortunately, is like, okay, you already have a full-blown developed disease or issue, but at least we're using this to treat the problem and trying to come up with measures to not make it get too worse. Okay, so for example, you have high blood pressure, you've had it for years, and we're at least taking this time to optimize the level. Blood pressure maybe runs in the 140s or 150s all the times. We're using this time to try to find ways to improve it. Lifestyle and medication. Appropriate medication in patients with coronary artery disease. So if you have a history of coronary artery disease, then appropriate medications, we try to address these things. If you have asthma, we try to address ways to not make it worse, right? So especially if you have moderate severe asthma, what action plan do you have in case you have an asthma attack? So these are examples of tertiary prevention. So this is why it's very important. And so when we say frequency, if you belong to the primary prevention realm, that means you don't have any disease that has been developed yet, then it can be on a yearly basis. So that you can see a doctor on a yearly basis, but keep seeing them. You don't see them once, everything is good, and you're like, okay, I can wait 5 years. Only God knows what can happen in 5 years, right? So keep seeing them on a yearly basis. Usually they'll do an appointment right that day, before you leave, they'll set up an appointment. If you saw me today is what, June 30th, you see me next year around that same time, 2026. Secondary prevention, again, we're trying to figure out if you do have something, if it's caught early, we treat it, you probably will see a doctor more regularly. And then tertiary prevention, you definitely will see a doctor regularly. But at the same time, it's still important to, because your doctor might not have time to address everything from a health maintenance standpoint. So it's still important to still see them on the annual visits where they can address vaccines, cancer prevention, and lifestyle and things like that. Okay, so that's very important. It's, as I'm bringing my presentation to a close, these are some of the reason why when we do healthcare maintenance or annual visits or annual checkup, we focus on heart disease and cancer is because when you look at this country, this is one of the most recent data from the CDC, 2018 and 2019, heart disease has been the highest or the number one cause of death in this country. So the dark blue bar, as you see, hopefully you can see my mouse cursor. So the dark blue bar represents 2018, the light blue is 2019. So it hasn't changed much between 2018 and 2019. And I'm sure that now that we're in 2025, the numbers are similar. And they've been like this for a long time. Heart disease being the number one cause of death in this country. Cancer being the second highest cause of death. And so it's not surprise that when we do yearly checkups, we focus on heart disease and cancer. And some of the chronic diseases, even if it's not heart disease, even if let's say it's cholesterol or it's diabetes, we know that these can actually also fall into the heart. They can worsen things so that you can develop a heart disease, right? And so all the things we're doing, whether it's primary prevention, whether it's secondary prevention, whether it's tertiary prevention, these are interventions aiming at lowering your risk of dying because these are very high risk for causing death. And then the third, I'm not going to go through all of it, but we're talking about health maintenance. So the first two are the important one. Then these are mostly like car accidents. But as you can see, the difference, heart disease and cancer is the number one killer in this country. And this is why it's important that you don't miss your health screenings. And then this is just cancer-related death. So we talk about cancer-related deaths. There's a difference between males and females, but lung cancer is the highest among both males and females. Prostate cancer, breast cancer, colon cancer, and so forth. So these are the highest causes of death, among cancer diseases. And so hopefully this can help. But the goal is everything we're doing. And by the way, I didn't go over everything because we could spend a long time. For example, if somebody's a smoker, we do lung cancer screening because it increases your chance of developing lung cancer. And so we do like a low dose CT scan of the chest on a yearly basis. If if you're a smoker, we do, for example, abdominal aorta screening, ultrasound of the abdominal. It's a vessel, it's a big vessel here that for smokers, you have a higher risk that it can inflate. And the danger is if it bursts, it's a life and death situation. Most people die in that situation. And so we do screening for that. And again, for example, pneumonia vaccine, it's more recommended among people who have things like lung disease, like COPD, who smoke, or people who have asthma, because there are higher chance of developing pneumonia. And so this is the reason why we do what we do during health checkups. And hopefully I was able to make this clear enough. We can ask questions. I apologize in advance for your questions. I'm gonna use the information I know in my brain, but I'm also going to use the evidence that I have on my computer to answer if you have any questions that I don't have a quick answer for. And if I don't find an answer, my information you can get it from PK, and I'll definitely get an answer for you in a timely manner.
All right. Thank you very much for the presentation, Doc. So there were some couple questions that you already covered, but I'd like to acknowledge it. Simeon says, can you take a few moments to talk about COVID vaccine? It's a subject that is very volatile. You already talked about that. And Dr. AI Phone says, would you recommend annual COVID-19 shots? Any comments on adult measles and shingles vaccines? And I think you touched that too. So at this point, please, if you do have any questions or concerns, please bring them up and we will ask them for you. We are gonna unmute Ben. I think you had a question, Ben. So can you go ahead and unmute yourself? And
before Ben talks, I think Dr. A's question about shingles, that one I didn't talk about. So shingles is a vaccine that's recommended at a certain age, and the reason is that when you reach above 60, you have a higher chance of getting shingles. And shingle is a viral.
Doc, can you stop
yes.
sharing, please? I think producer tried to project you, but because you're sharing.
Sorry. All right. Give me a second, please.
There you
All right.
go.
Thank you. So yeah, so shingles can cause a severe pain. Usually develops along the nerve distribution of your body, usually in the upper body. And even though it's rarely deadly, the pain and the suffering that it can cause is what makes shingles vaccine recommended. I've treated shingles in some patients, and trust me, the way they were miserable is something I wouldn't wish on anybody. And treatment is not immediately. It doesn't go away. It doesn't treat the problem immediately. It takes time. And so, that is something that we usually recommend. I think is the age of 60, and to get a shingles vaccine. It used to be in 2 shots. Now it can be done in 1 shot. Shingrix. And so it's something that I would not take lightly. And if you don't have anything against vaccines, I would recommend getting it. So that's what I'll say about that.
All right, Ben, please unmute yourself. Then after that, we're gonna call Francis Ofori to also unmute himself. Just unmute yourself. Tell us where you're calling from and your question.
Hi, thanks for the presentation. Really insightful. I'm calling from Boston. My question is about the Tdap vaccine. I've had it a few, probably twice, as far as I can remember. But what my question is what normally would trigger a whatchamacallit? What is the vaccine? Yeah, right. So like I'm drilling, I'm doing some housework, I prick myself. Like what would normally trigger that? Is more risk? Like I guess what could you consider something that if you did happen to you, you're at risk of getting that tetanus?
So that's a really good question. So when we think about tetanus, we're referring to it's a bacterium. Okay, so this bacterium is called it's called Clostridium tetani, These bacteria essentially they cause muscle spasm and stiffness, and is found in soil. And the reason why we recommend tetanus vaccine for people who injure themselves is because it tends to be found in soil, dust, animal feces, especially if you get injured with something rusty, usually by means of puncture wounds, for example, rusty nails, needles, and things like that, burns, surgical incisions, insect bites, IV drug use, and this is what how you can get it. It's not contagious. It doesn't spread from person to person, but it can cause those the stiffness in the muscle spasm. It's almost like you're having like a seizure occurrence.
Okay.
And so this is why we recommend getting the vaccine all the times to be up to date. And also if you get, especially if you get like a wound or something like that, we recommend getting a shot at that point.
Okay. Thank you. Francis, please forgive me. I think Charlene raised her hand before you. Looking at the order that I have over here. So, Charlene, please unmute yourself and tell us where you're calling from.
Hi, I'm calling from Dallas, Texas, and my question is not really in relation to routine checkup, but it's something that I've just noticed over the course of years and something that's coming up this year mostly. I want to ask the doc, and thank you for your presentation. It's very, very insightful. So I want to ask about your thoughts on PrEP. Just because a lot of studies this year has been showing that a lot of the HIV test that's been done, 50% of Black women are affected by the rise in numbers. And the reason why I'm asking is, as a married woman, or some people who are married, we get into this comfort level of, oh, I'm married, I don't need to do routine STIs. And you find yourself with a disease that you could have prevented either by being on PrEP or just maybe every so often doing your STI test for HIV mostly. And the reason why I asked is there was a lady who had cancer. She survived it twice. And she was older in her 60s and she contracted HIV from her husband who was imprisoned. And he never told her. He knew he had HIV, but he never disclosed his status to her. And she married him later in life. And so she ended up succumbing and dying to HIV. Whereas if she had known earlier, it wouldn't have killed her because she survived cancer twice, which was worse. So my question to you is, number one, why is it that HIV test is made mandatory when you're pregnant before you have delivery? So, and why is it that it's not being taken seriously in the US, maybe making it a requirement for people, not just during surgery or when you're pregnant about to deliver, how can we, like, why is it not
Okay.
that way? Yeah. Thank you.
So thank you. Your question is fully loaded. I'm not an expert in HIV treatment, but this is what I will say. What we know about PrEP, and by the way, for those who don't know what PrEP stands for pre-exposure prophylaxis. So pre-exposure prophylaxis means that you are taking a medication against HIV before you've been exposed to HIV. And so you might want to have sexual interaction with someone that they are high risk for HIV, or you might be living in a community where people are promiscuous and HIV is prevalent, or for example, condomless sex with people that you don't fully know, or you think you know, but there are questions there. People who have had partners with HIV in the past, uh, people who men who have sex with men. So these are people who have a higher risk of getting HIV. And PrEP was meant to be for people who don't have HIV. So you don't have it, but you're taking the medication to prevent it from happening, from prevent yourself from getting it. from contracting it because you had sex with someone who had HIV. Now, the recommendation as of right now is that it's recommended for individuals belonging to this population, these high-risk individuals, or individuals who are relations with high-risk individuals. It's not recommended for everybody. And in a situation when you're married, you thought you knew the partner, but you didn't know them. I don't know how you could make it a standard recommendation than because the reality is that nobody who's married knows 100% the other person, right? So there's an element of trust that was built maybe before marriage, during marriage, and so forth. But this is the thing: the moment you have a high suspicion or any suspicion that your partner is having sexual activity with other people outside the marriage, that very moment should be a moment to have counseling with your doctor about PrEP to protect yourself. We don't have, as of right now, a recommendation for anybody to be on PrEP unless they belong to high-risk population. But the moment you have suspicion that your partner was being promiscuous or whatnot, you, in a way, you do, enter that you do belong to that high-risk population, and you should have that conversation with your provider about PrEP. Besides, what else you're gonna be doing about your relationship. But from a healthcare standpoint, that's a good point. So that's something that should be done. We don't have recommendations, wholesale recommendations for a people otherwise, like let's say a particular race or a particular every married person should have PrEP. We don't have anything like that.
Okay.
So that's what I would say about that. Now, you also mentioned what was the second part of your question?
I think it probably
The
encompasses
second
everything.
part was about like HIV being the test being recommended for pregnant women, people who are about to
Okay.
have surgery. Yeah.
Yes. So the reason is that there is something called vertical transmission. So during pregnancy, HIV can cross the placenta. The placenta is that membrane that separates the baby or the fetus from the mother, right? So during pregnancy, it can cross the placenta, and so that's the reason why we do HIV screening for every pregnant person to protect the baby. And the baby, even if it doesn't happen during pregnancy, the baby can encounter in the process of being delivered. So as they're passing through the vaginal orifice, they can contract HIV that way. And because there's a lot of exposure of the mother's blood with the baby's blood, that's how they get it. And so that's what we call vertical transmission. And also during breastfeeding, HIV can be transmitted through breast milk. And so those are all the reasons why we are very cautious about that, and we screen pregnant women right at the first prenatal visit for HIV. Hopefully that makes sense.
Okay. Due to the time factor, we will just move on and we'll read this question and call Francis and we'll call up after that. Thank you, our sister, very much for your question. Yeah, that's what I said, Francis. So John Agbe's question says, please, Doc, on what basis will you recommend, admonish against the use of fitness trackers as early telltale sign?
Okay,
Sign
I think
diagnosed,
what
undiagnosed underlying medical conditions.
I think what he's saying essentially, nowadays we have a lot of wearable devices, right? Whether it's your Apple Watch, whether it is your Fitbit, whether it's other trackers, and they're good. Actually, I couldn't recommend against it, to be honest. The reason is that I've had patients myself. Again, I'm a sleep specialist, so I deal with a lot of sleep apnea. I've had patients who didn't even know they had sleep apnea, but their watch told them that when they sleep, their oxygen drops. And that's the only reason they came to see me. They didn't have otherwise clear signs of sleep apnea. They were not obese. They were not snoring loudly and so forth. And that's how they found out. I've had patients who found out they had AFib. AFib is this atrial fibrillation, is this dangerous irregular heart rhythm that we have pretty good grasp on how to treat it. But if it's not treated, it can actually cause problems to the heart, and it can also cause stroke. And I've had some patients who were able to detect they had AFib, didn't have any previous diagnosis of it, through their wearable devices, fitness tracker or whatever. So I cannot, I think this isn't an easy one to answer. I can't speak against it. I think if there's a downside to it is that some people do get too paranoid about it. And it's not an exact science. So it doesn't have a gold standard. For example, when we talk about EKG, somebody mentioned earlier when I asked like what kind of tests we do for health checkups, EKG. The EKG or the ECG that the device is able to read or transmit or report is not as accurate as an actual, 10 lead EKG. It's not. But it's 12 lead EKG, sorry, but it's actually it can be it can be a screening method really that gives you an alarm. Why is my tracker saying that my heart rhythm or my heart rate is like in the 150s when I'm not even exercising? And that can lead you to go see a doctor. And so
Right.
yeah, that's what I would say
Okay.
about that.
Francis, please unmute yourself and tell us where you're calling from.
Okay, thank you very much. I dialed in from Utah. I have a quick question. So, I think when I was growing up, we were told that good health is a state of mind. So, that means whatever your mind tells you. If your mind tells you have headache, then you have headache. If it tells you have backache, then you have backache. And I've been trying all these years to reconcile that with going to do regular checkups. So, like, I have never done ACE test, and I thought, okay, if I don't know that I have AIDS, it gives me peace of mind. The moment I get to know that I have HIV, it's gonna weigh on me. And even so, the thinking of that will actually kill me faster than the ignorance of it. So I had that perception. Two, if we go for regular checkup, do we have to tell the doctor exactly what the doctor has to check for, or the doctor knows exactly what to check for?
Okay, so thank you, Francis, for your question. So I think the first was a statement, right? You're saying that essentially you were conditioned while growing up that it's a state of the mind, and sometimes if you don't think about it, essentially you're better off because if you don't know about it, you're not gonna worry about it. But if anything, what we're saying in this presentation, I think you've captured it, is that early detection will save you, will give you a long life, essentially, will save you. And so if there's a suspicion, it's good to check it out. Now, if you go see a doctor, the doctor will do the basic things as we mentioned earlier in the presentation: cardiovascular screening, cancer screening, chronic disease screening, immunization, vaccination. Those are the pinnacles of healthcare maintenance. If there's something else going on with you, for example, my sister earlier who was mentioning an example of if somebody was in a relationship and I think it was a real story. Somebody, married somebody, they didn't know them and they end up having HIV. If you have something like that going on, if you don't bring it up, it might be missed because we will try to be as thorough as possible in asking you everything about your life, especially if it's the first time you come to see us. But obviously, like I said earlier, time restraints make us not have the time to ask every single thing. So if it's something that's there that was missed, at least you can bring it up. And you might not know what test to do, but if you bring up the problem, the doctor will know what test to do. They will know who to refer you to, and what to do about it. And so what I'll say is be as forthcoming as possible. You don't have to provide the details about who did you do something with. For example, we talk about HIV, or the details, every really details about everything, but make sure that you're forthcoming about any health concern you have so that we can address it.
All right.
Hopefully makes sense.
Oba, please unmute yourself. And for the purpose of those who don't know you, tell us where
Thank
you're
you,
coming from.
PK. Hi, everyone. Hope all is well with you all. Doctor, I have a question. So for the past few
About,
years,
can you tell those who don't know you yet where you calling from?
hi, yes, I am calling from Worcester, Massachusetts, in the New England area.
All right.
So I've lost, I wouldn't say lost. Yes, I know quite a few people who we've lost due to prostate cancer. Um, what advice or what can we do as a community to help our men in particular, I guess, when it comes to take better care of their health and to take these screening measures, importantly, because oftentimes I've seen quite a few of our men in the community deviate from the normal standard for treatment, and they opt to go back home to do herbal treatments, etc. And then later on, it's a bit, late for them. So, what can we do as a community to better enable our men to take better care when it comes to prostate cancer or prostate enlargement?
Thank you for your question, Oba. And it's not an easy question to answer because I don't know if you heard my introduction. My premise was that the reason why I don't want to say too much or spend too much time on this presentation is that a lot of us know about this. We hear about this. We've heard it in on different platforms. But a lot of us are stubborn, right? And again, the mindset of and our brother Francis that made the comment earlier. A lot of us maybe were conditioned like that. That if I don't know, I don't have to worry about it. But the reality is that a lot of these things are preventable, right? So it's no surprise that we call this preventive care. And so, besides trying to create awareness that there are tests that can be done, again, there's some controversy around the PSA, the prostate specific antigen test, because of sometimes leading to unnecessary testing and treatments. But at the same time, you're right, a lot of people do die from prostate cancer. And it's good to at least know. And I had a patient. This is what I'll end with about your question. I have an African American patient who is very, very, very distrustful of the healthcare system. He's very distrustful of Caucasians anyway. He's always defensive, and it's due to experiences he's had in the past, right? And some of the realities that we live in now today. But he was diagnosed with prostate cancer, and he came to me, and I'm like, listen, I only treat you for insomnia. I don't treat prostate cancer, right? But he wanted to hear from someone he can trust whether he should take the advice he's getting from the oncologist seriously or not. And he had a long talk with me about it, and I was like, you know what? I'm not an expert in this field. What I'm gonna do is to connect you to a urologist that I know. So I actually contacted some folks, and I spoke to a Ghanaian urologist who lives in Atlanta, and I presented my patient's case in full detail, sent him documents and everything, and he gave me recommendations, and the patient could trust me, right? And could try, and I told him, listen, you can trust this guy. He has nothing to do, he has no benefits, right? He has nothing to gain by telling you you should get treatment, and out of the treatment options you're now being confronted with, this is the one you should go with. He went through it, things went well, he's happy, and now they're talking about there's a little bit of the cancer has spread somewhere else. He should get radiation, and now he's talking to me again too. So maybe what can help is connecting having more connection, networking, I would say, among Black providers, maybe African providers, maybe can give our fellow men more reassurance. But the information is, what's being presented every time. Prevention is better than cure, and so that's all I'll say about that.
All right. I think we have a last question from Alex. Then after that, we'll bring the show to an end because we have like 1 minute left. So Alex, go ahead and please unmute yourself. Tell us where you're calling from and ask your question.
Yeah, I'm calling from New Jersey.
Yes, sir.
Doc, what are the dangers and precautions for someone with a silent heart murmur?
Okay, good question. I don't think there is such thing as a silent heart murmur, but I know what you meant. A heart murmur that might come and go, but that might not, otherwise be associated with any other heart disease. It depends. So the important thing, number one, is for you to know that you have a heart murmur, and for your doctor to know, and your doctor to know how loud it is. Because what we should do is, okay, let's say you're my patient, you come to me for the first time, or I've seen you for some years, but for the first time, I'm hearing a heart murmur. You don't have shortness of breath, you don't cough, you don't have any chest pain, you don't have anything like that, you don't have palpitations, but we heard a murmur. Okay, this could be multiple different things. It could be an aortic valve problem, it could be a mitral valve problem, it could be different things. Could be like there's something we call like concentric um, hypertrophy of the heart. So it could be any of these things. Now, what we do if you don't have any symptoms, that's usually reassuring because it tells us that it's unlikely anything serious right now. But important thing is to document it and to be able to track it so that every time I see you, I check it. If it's getting louder, that means that the valves, one of the valves in your heart, is getting thicker and thicker, or is getting stiffer and stiffer. Sorry. And so maybe it needs to be monitored. Maybe we should see a cardiologist to do an echocardiogram to make sure that things are not too serious. And so it starts with at least acknowledging you have a murmur, making sure that it's being monitored every time and that it's not getting louder. And your doctor will have to take that leadership. Some doctors will take the precautionary step of, as soon as they hear a murmur, they'll have you do an echocardiogram. That's might be a little bit too much, but that's something that the doctor can offer. And I'll say, if they're offering it, do it at least to have a baseline so that in the future it can be compared to this test. That's what I'll say about that. Hopefully it's helpful.
Thanks.
All right. Thank you guys very much. Doc, I know you have other businesses to attend to, and we want to say big thanks. I think there's some questions in the chat. We're gonna ask those questions and just draw the curtains to the show. Ben it was says, Francis Offer says thank you. Ben says you got the constant analytics, and Francis Offer comes to say thank you. Ben it was says more of these sessions. Yes, we are getting to the season of medical topics, and we're gonna be seeing that coming a lot. We're gonna be talking about sickle cell pretty soon, and my very best friend will be talking about that. He's also very good friends with Dr. Steven, so Dr. Say will be running us through that one pretty soon. And the Melly says in the US, blackdoctors.org is a good resource for disease awareness. And iPhone 60 Pro Max says, okay, since I may not have the opportunity to ask my question, this is outside the topic discussed today. The link for the Zoom pops up only in the flash, and if you are not able to join immediately, it becomes difficult to join. Kindly help me regarding how to join in the future, please. iPhone 16, you can unmute yourself and ask. Well, you're already on mute, so yeah, you can unmute yourself and ask your question that you want to ask. Dr. A iPhone says, excellent sessions. Thank you, Dr. YEBOAH. So go ahead and iPhone 16 Pro Max. We're gonna end with you. Then we're gonna wrap call an end to the show. Tell us what your name and where you're calling from.
My name is Pastor Emmanuel. I'm in Virginia.
Okay, Pastor Emmanuel, go ahead.
Yeah, so my question basically is, once in a while I realize that I'm holding the phone, right? And then the tap system pops up, and then you see that the program is on. But if you're not able to join immediately, let's say you are doing something and you want to join later on, you realize that you're not able to log into the system. And I don't know why it happens so I want to find out.
So this is what that is just an enhancement process that we give out to our customers to help them, get easy access, just like you said, user friendly to just join. But we send emails out to everyone. So if you're getting that app popped up on your app, if you get that link popped up on your app, you definitely get the email. You can always
No,
go
I
back
never
to.
get email.
You never
I've
get
never.
email.
No.
Okay, so right after the show,
Uh-huh.
stay over for the Q&A session, and whoever also has a similar.
Tell them to join the chat room. It's easy to get that access. I just posted the link.
Okay, so there's also a chat room that you can also join, and also A Class is gonna post the Startup Send chat room as well. So we have two chat rooms. The one that was posted by Sani is the chat room for the HRE TV, where we discuss topics and future topics that we want to hear. And A Class and Director Danny will post the Startup Send chat room, where any questions concerning startup, so we can talk about that. But like I said, stay, hang around. Hang around for the Q&A session of Startup Send, and we can also get your information. And if you're not really getting access to the email, then that is because you have Startup Send, right?
Yeah.
Okay, so you should be getting email. So there might be a glitch, and Director Danny can help rectify that. So with that being said, we want to say big thank you to Dr. Steven for coming out and just giving us this great presentation. We're gonna call upon Director Danny or A Class to give us the sign up message, and we thank you very much for coming, and we hope to see more of you on this platform. We know you're the newest dad in town, but we still hope to see more of you before the twins comes. Director, what's the idea out by
Dr. Stevens' number.
Oh, Dr. Stevens' number cannot be given now because, like you said, if you have any issue, just reach out to your primary care. But if there's just a random question that you want to ask, then we can do that. Again, he's gonna be part of the platform, so you can, if you have any question, he can respond to you there, or maybe because per situation whereby it's gonna, because he's not open for consultations, if I may put it that way. Say or because Dr. Steven, you don't have your private practice right now, right?
No, I don't. But what I was saying is, if somebody has general question that we're not able to address, they can still maybe get my information from you. Is it okay if I leave my email here on the chat?
Yes, please.
And it's gonna be my personal email, not my business email. So you can use that to ask whatever question you might have. Again, it has to be general, not personalized.
Okay. All right. Thank you very much. Director, can you please sign out?
Ok, dottore, grazie tanto per tutto quello che ci ha detto.
Oh, grazie mille a te, grazie.
Ci rivediamo.
Ci rivediamo, sì.
Producer say, before bed was producer say, Director goes, yeah, you chew a poor.
Now, anyway, PK, can't you, I mean, I don't know, as a producer, the catcher the week.
All cases here, we have an open book.
No,
I did you and pour the cow.
PK, I can testify that he knows he's Italian.
Oh, Director.
I can testify
we know
to
Director.
that.
We know Director. Everybody else can testify. Say, Pigeon of him. Pigeon Italian. PG Italian okay.
Now can say A class ba na me share that area mu fast because we mu ba be
A class no be kind of Italian.
Aye. Okay. Also we chill and pour the bag.
We'll proceed here.
Anyway, so doctor, we thank you very much. I mean, it's been a wonderful topic. But PK, I sent you a message to ask for me. I don't know if
no, because my phone be freezing in and out. It's been checking a message,
okay,
right?
Okay, sorry. So I just had an information. I don't know if doctor, you can just help me out before signing out. I mean, what effect does Wi-Fi has on our kids, or let's say ourselves? Is can we get like sleep? How do you call it? Insomnia or those stuff? I mean, any effects?
Was it from Wi-Fi?
Yeah.
To be honest, I'm not aware of that. Okay. I have to be more up to date. Maybe I'll look it up and I'll let you know. I'll let PK know if I find something.
Okay.
If you're saying Wi-Fi specifically.
Yeah. Because I'm having some complaints and stuff.
Okay.
And I doubted because I think this theory came out before. I think when how do you call it? COVID-19 came about, and people started making that noise, like because there was fiber,
Mm-hmm.
whatever.
Fiber
So,
optic. Yeah.
started making it is linked to COVID-19 and stuff, and now they're saying you can get sleep apnea, insomnia, stuff like that. And I mean, I can't just orient myself in this stuff. But anyway, thank you very much for the information given, and I hope you come back again. And then the last time I learned a lot of things today too. I mean, anytime you come on, it's a great insight, man. And I
Thank you for having me. I appreciate
personally, I would say
the honor.
Okay, Italian
I would say
kamataba.
grazie.
So ka Italian. O da kofa brofo bravo bre.
Right.
Oh man.
You see how fast he was with the Italian, but do English. No, you the one was say perfume rice. Bars.
Na pii kura me kan obenya asem nti me hu.
Director, yeah, that was it. Thank you guys, and Dr. Stephen, Director, I'm going to sponsor this show for us to be able to reach out to you and also feed our viewers and our audience with nothing but great nuggets that we can use in our daily lives. I want to say big thanks to all our viewers wherever you at. Or Bokompaya and Mabobiama, your sponsors in teach you Checkups and also we want to say big thanks to even those that were not on Zoom, those that were on Facebook, YouTube, thank you guys very much. And I'm also the Digimedia Ebama Boboano. Edian be just so a PK Ofori-Asenso. Be producer directors, Nana Lord, and also Nana Kwesi Wideout, as well as director himself and also A Class, helping us bring this show to you without any issues or discrepancies. At this point, I want to say, please join the link that has been posted by A-Class and producer. And those of you asking for my contact number, once you get to the platform and you mention my name, I will pop up like Agama Lizard and we'll be able to, interact. My number is just Obiawa my number to be. I say, wait, don't know. I believe also no. It'll be our number to be. Until please let's communicate over there. And also, if you have any questions or concerns, I can always relay that to Dr. YEBOAH for you. And his email address is already pasted in the chat as well. So we're not gonna go off Zoom. We're not leaving. This is the first segment of the show. We're gonna sign out on live on Facebook and Zoom, Facebook and YouTube. So please migrate to the Zoom account so that we can all interact, which is being led by Uncle Jimmy and the team, Auntie Cece and also Auntie Liz and also Oba and Kofi Boatin, the rest of all the leaders, Dorothy Timunina will be there to help answer any questions or concerns that you have concerning your Checkups app or anything that has to do with Checkups. Even contributions, or not say if you open say upload them more, come and just applaud them for the good stuff that they're doing. On that note, I want to say thank you. God bless you. I'll see you guys next week. And next week is going to be a very good topic coming your way. We're going to be talking about something that has to do with finances and also how to keep up your finances and not be broke. And if the topic changes, as usual, we will paste it and let you guys know. And we'll take it from there. God bless you. I'll see you guys next week, same time, same channel.